elderly patients who cannot lie down prone, we can do MRI with arm by the side of the body, but then as it becomes more of eccentric, you might not get very high resolution images which you get with the Superman position when the wrist is in the center of the magnet. When you are looking for the distal radioulnar joint instability, sometimes we might to do pronation and supination, both MRI to evaluate the relation of the distal end of radius and ulna. Protocols, everyone has their own protocols for any joint. Everyone is comfortable with certain sequences. What we do is, for wrist, we take one T1 coronal, one fat set PD coronal. These are the two coronals that we take. Two axials, T1 and PD fat set again. One sagittal PD fat set, and we usually take one 3D gradient image. This is an excellent sequence which allows visualization of the TFCC as well as all its attachments in a very nice way. As it is a 3D sequence, you can see these small ligaments which you might otherwise miss in your routine 3 mm MR sequences. So it is always good to add one 3D to your protocol to see for these small structures. MR arthrography, just like shoulder, wrist arthrography, it is reserved for certain selected patients. However, for shoulder arthrography, we used to do a lot of arthrographies in earlier years, which is now reduced. In wrist, it is opposite. We didn't do many arthrogram in the earlier years, but now we are doing many wrist arthrograms because the clinicians, they have certain specific questions. They want to see for the foveal attachment of TFCC. If this is one query and whether they want to know whether it is a torn or not, whether it is completely torn or partially torn, then with MR arthrogram, you can get some additional information many times. It can be performed with 3 joint injections in the radiocarpal, in the midcarpal as well as the distal radioulnar joint. This is the standard technique, but now usually what we do is we just inject in the radiocarpal just one compartment, and then we see for the leakage of the contrast if it is going in the other compartment or not. And that way we can get almost all informations and we don't need to do 3 injections.